Thank you, sir.
Srimati Kanimozhi.
On the onset, I welcome this bill, and in spite of things which have been pointed out about the number of amendments, everything, I still am happy that at least now that this bill is coming. We've been waiting for a very long time for this bill, and I like to congratulate our LOP, who was the then health minister, who initiated this, and the Minister for Health now for bringing this bill. It's a very progressive bill, and sir, but this bill is a very ambitious bill. It puts a great financial burden and responsibility on the central and the state government. According to WHO, India spends a meager 0.06% of its total health budget for mental health care. With this budget, how does the minister actually plan to really do what he is planning and what he is promising in this bill? And our country, as many people here have pointed out, it has a shortage for psychiatrists. We have 1 per 3.5 lakh people. And sir, I think we cannot increase this number overnight. But as this whole system, as this whole program relies very heavily on the present public health care system, they have not got a different structure, different infrastructure put into place for mental health care as yet. And this relies very heavily on the present public health care system. I think we should start having training, continuous training for the present doctors and the PHCs and the nurses, so that they can also, I mean, this is not the best, but at the moment, for the present, I think they can also be able to identify, because it's very important to identify the problem when there is depression or need for mental health care. I think identifying it is very important, and especially in a developing nation where there is poverty, acute poverty, and people suffer from poverty. That also the distress from poverty actually in many cases has been read as depression or mental health issues. So like we cannot legislate poverty and do away with it. But many patients who are distressed because of that do not have the energy and do not have the willpower even to assess the welfare schemes given by the state governments to them. So it's very important for the doctor to identify these patients and should be trained enough to identify these patients. And in many cases, there are medicines given to PHCs. But the doctors are not used to prescribing these medicines. They don't know how to prescribe these medicines. So they do not, even in spite of medicines being available, it does not reach the people when they need it. So I think continuous training, till we really are able to meet the ideal target of psychiatrists which we need, I think that should be taken into seriously and looked into. And sir, you're trying to set up new boards, bring in new people, but already you have a lot of financial constraints and not much budget allocation is there. Is it possible to use the social workers who are already there in the system, in the healthcare system, to be included to support this? And the bill doesn't talk about allowance, disability allowance. Already when there are people with physical disabilities, allowances to them and support to them does not reach them, and you need a doctor to certify the percentage of disability they have. And in these cases, it is very tricky and very difficult to identify that. But it's a great financial burden, because these people in many cases are not able to work, and it's a great financial burden to take care of these patients for the family. So definitely we should think about an allowance to these people. And the more important thing is to reintegrate these people back into society. It is not alone important, it's not alone enough to actually treat these people. to give them medication. That is not enough. You should give them the confidence, you should give them the way to take care of themselves. Like when Mrs. Renuka Chowdhury also spoke here, she brought up a very important point that many parents are worried about the future of their children. Once they are no more, there's nobody to take care of their children, and there's no support system today. I mean, we see that sometimes we even think, because there's zero help, zero support in the society for patients with mental illness, that we even think that tying them up or chaining them is okay, so that there's no injury or harm to them. We think that is perfectly all right. And there are instances where there are temples or other places of worship where they taken these patients, but even they do not have the medical, the wherewithal to support them. So they also do the same thing of tying them up or keeping them chained. So this is the way our society treats these people. So I think we should put in a proper system and very fast to take care and to solve this issue. It is a very, I appreciate that you're talking about advanced directive in this bill. But then we have to take it very cautiously also. In India, where there is a lot of family pressure, social pressures, a person cannot make the right choice even when they are in a mental state to make a choice about how they should be treated and who should take care of them. A woman in a family cannot name somebody else. She can't name somebody outside her family, or she is actually expected most probably to some in-laws or her husband, even if she knows that they will not give her the best treatment. So in a situation like this, I think we have to approach this very cautiously, because yes, this is a very progressive idea, advanced directive, and the patient can decide how they, and not many people are educated enough to know which is best for them also. I think we have to approach this advanced directive in psychiatric care in a very, very cautious way.
Okay,
Though it's a very good thing, in our circumstances, I think it can be a double-edged weapon. I appreciate the step taken to decriminalize suicide. It is the need of the hour, and I really support it. And I think one of the most important things which we should be looking at is to reintegrate them back into society, to support them to support themselves and give them back their dignity. That is what this bill should be working towards. Thank you, sir.
Kanimozhi ji, thank you.